Bismillahirrahmanirrahim. Today's our topic is enteric fever, which is also called typhoid. What is enteric fever? The simple name, the common name of enteric fever is typhoid. So typhoid is related to infective disease. We discuss the enteric fever and the internal medicine in the chapter of what? In the chapter of infective disease. First of all, we will discuss the definition of enteric fever. Enteric fever is a clinical syndrome characterized by the constitutional and gastrointestinal symptoms and by headaches. A form of enteric fever. Typhoid is a typical form of what? Enteric fever. It is caused by Salmonella typhoid, and sometimes it is caused by the Salmonella paratyphoid, A, B, C, and so on. Now we will discuss the etiology. What? Etiology of what? Of enteric fever. What is the etiology of enteric fever? And the etiology and the causes of enteric fever or typhoid, we discuss the transmission, through which way they transmitted. This infection is transmitted. Salmonella paratyphoid is transmitted. The cause of typhoid fever is what? Is Salmonella typhoid. Maybe sometimes Salmonella paratyphoid. So the transmission, through which way the Salmonella paratyphoid is transmitted, we say transmission. So they transmitted through contaminated food, oral fecal, or we say oral fecal. So oral fecal means through contaminated food, water, milk, and etc. After transmission, we discuss the source of infections, through which source they spread up. So we say source of infection, infected excreta of carrier individual. So now we discuss about the pathology of enteric fevers, how they cause a disease in the patients. So whenever, after a few days of bacteremia, what is bacteremia? Bacteremia means whenever a bacteria in the blood, for a few days, the bacteria localized mainly in lymphoid tissue. This bacteria, this bacteria localizes in what? In the lymphoid tissues. Whenever they localize in the lymphoid tissue of the small intestines, the typical lesion and the pear patches and the follicles. So what is then these pear patches? These pear patches inflame it first. Whenever pear patches is inflamed, then ulcerate and ultimately heal. But during the sequence, they may perforate or bleed. This is the pathology of enteric fevers. Now we will discuss about the clinical feature. After pathology of enteric fevers, we discuss about the clinical feature of enteric fevers. What is the clinical feature of enteric fevers? We divide the clinical feature in a few weeks. What will be happen in the first week and the second week and so on. First week, stage 1. We also call the stage 1. Stage 1 is slowly rising temperature for 4 to 5 days. Means it is also called stiff ladder fevers. It means that the temperature may be high in the night times and maybe less at the day times. So the first week sign symptom is what? Abdominal pain, malaise, headache, and constipations, and bradycardia. Bradycardia. If the patient is not treated at the first week, the patient goes to the second week. So now, if the patient is untreated, the patient goes to the another weeks, which is also called second week, yeah, end of the first week. Whenever the first week is at the end, the patient maybe he feels, yeah, maybe rose spots may appear on the upper abdominals. So rose spots appears on the upper abdominals. If untreated, a patient not goes to the doctor and they not treated his enteric fevers, his typhoid, rose spots on the second week appears on his abdominals. Maybe cough appears. They feel coughing. They do coughings. And the third one is splenomegaly. Some problems maybe occur at the spleen of a patient, and if they are untreated, they maybe feels diarrhea. What is diarrhea? And the third week, we say third week. And the third week, if untreated, the patient not goes to the doctors, and his typhoid is untreated, so on and so on. The heart they feels somewhat depressions, and then maybe coma and death maybe occurs. So patient must be go to the doctors and treated as enteric fevers. After clinical features, they also have complications. What is the complication of enteric fevers? We have some problems maybe occur in the intestine of a patient, maybe in the intestine and hemorrhage. What is hemorrhage? Hemorrhage, we say shock with the blood in stools, and we also the other complication of the enteric fever is septicemic foci. What is systemic foci? We also say that they may be include arthritis, meningitis, nephritis, pneumonia, and myocarditis. This is all the complication of enteric fevers. Urinary retinations. Urinary retention is also the complication of enteric fever. Now we discuss the investigation of what